let's do this. We're going to talk about, thank you guys. We're going to talk about lymphedema. And I truly feel, and you guys please put in the comments whether you agree, that this topic is so not discussed and really sad. I had a friend who had chronic lymphedema. If we don't educate and talk about this, it's not going to get out there, and people will suffer for a very long time. So James, can you tell us what you do, who you are, and why you do what you do, and why you're with Learn Look Locate? It's a lot.
Most definitely. Thank you for having me.
Absolutely.
My name is James Saviers. I'm an occupational therapist by trade. I've been a lymphedema therapist now for 12 years. Started out in generalized lymphedema therapy and have progressed to specifically do cancer-related lymphedema, and primarily breast cancer-related lymphedema. I've worked for a cancer clinic in Arkansas for the past 3 years. I started the program there, and we are up to 3 therapists now and several locations throughout the state of Arkansas.
Come closer. We keep hearing you and then you fade out.
Oh, sure.
Yeah.
So the reason I do this is because of exactly what you said. It is such an underserved population and very undereducated population. And I really enjoy teaching. I really enjoy working with the patients. It's a very, very motivated group of patients to work with. You all want to get better, and it's motivating to me as well. I work with you because I believe in what you do. I believe in your journey and in educating patients newly diagnosed with breast cancer. It's such a scary time to have that diagnosis, and what you provide as far as education and resources is it's unmatched. And I really appreciate being able to work with you. I do.
James, and if it's okay to share personally what you're dealing with, is that okay?
Almost definitely. I actually wore my shirt. I wear pink for my wife, as you can see. Well, you can't, but I think everybody else can. Yes, my wife was diagnosed with breast cancer in November, almost 2 years ago to this next month. Triple negative breast cancer, and luckily now, thank goodness, is cancer free. She still takes she had a BRCA positive breast cancer, and so she takes Lymphology now, which is exhausting for her, but she's doing very well on it.
Yeah, and you guys should know that James came on before his wife got diagnosed, and I think really, he deals with it all day long, but then to have it hit close to home, it's a lot, and she's young, and it just broke my heart when you told me, and there's just too many people getting hit with this, you guys. I'm actually having a hard day with it. I feel my heart is heavy with this disease, maybe because it's October, I don't know, but and I'm trying to unravel the package of what we're faced with and how much we have to process, from reconstruction to lymphedema to, do we want aesthetic flat closure, and do you want a lumpectomy, and then do you need genomic testing? I mean, it is just out of control. So by taking each topic page by page in a bite-sized way is what we're trying to do. And that's where James really helps us understand that lymphedema is definitely something that can be managed. So, here's the silver lining. And for those of you that have been following me a lot, I do things maybe over the top with some bright colors, but I do want to give us hope. And I think James, what he does is like a beacon of hope. And there should be more lymphedema specialists in the forefront who agrees with me of when we're faced with this. And can you talk about that, James, and how this, your involvement, specifically even at CARTI, happens with a breast cancer patient so that you guys get ahead of this?
Yeah, we try to focus on
Closer.
prevention.
It's hard to hear you, James. And
Okay.
is a phone blocking your microphone? Because I'm going to be cutting these up to little videos, so I want to make sure we can hear you.
Sure. So I really try to focus, and we as a program try to focus on prevention as our primary area. And we have started using bioimpedance. We see patients preoperatively, and we try to get them on our bioimpedance machine, which gives us a score. And we then see the patient 3 weeks post-operatively and retest them. We provide them with education. We test their function, their range of motion, circumference measurements, and then we follow them. And so with bioimpedance, it's a machine that sends high and low frequencies through the body and measures fluid volume change over time. The way that we do this is we test 4 times a year for the first 3 years after diagnosis, after surgery. Then we test twice a year for year 4 and 5, and then once a year for year 6 through survivorship. And if we see a change in our scores of a certain amount, then we can start a very conservative treatment approach that provides the patient with lymphedema compression garments, and we teach massage and other educational activities such as exercise and stretching, and allow the patient to really be independent with their treatment. And it also provides a lot of ownership to them, and is very effective at reducing the chance of developing lymphedema as a chronic condition. The main way to treat lymphedema is to prevent it. If we don't start that process of swelling and it becoming a chronic condition, then we can really stop it before it becomes an issue.
And by doing this, you're able to stop it. This is prior to surgery, after surgery? Help me to understand.
Sure. Well, it starts preoperatively. It starts before the surgery occurs. We get a baseline measurement, and we provide education to the patient on what activities they should participate in, what activities they should avoid. They go through their surgery, lymph nodes are removed and sent to pathology for biopsied and sent to pathology. And then we see the patient 3 weeks post-operatively. We do another test, and then we see them throughout their journey and then through survivorship.
So if someone's newly diagnosed, are you saying that they should ask for, say the name of the test again, if you don't mind?
It's called bioimpedance spectroscopy.
Now, does every cancer center have this lovely test?
Unfortunately, no, they do not. And it's if the cancer clinic doesn't have this type of technology, then seeing a lymphedema therapist is still very effective at reducing the chances of developing lymphedema through education and circumference measurements with a tape measure.
So who on here has heard of this? If you guys can comment, and have any of you, had the education prior to your surgery? I did not whatsoever. Know about this so that you could get ahead of it. I would love if anyone could just comment. It's so hard to know. I can't even see you, but to interact and understand. Because this is where I feel, and that's why, hence, Learn Look Locate. How are we supposed to know this, James? It's so frustrating. And then if somebody doesn't know this and then they're stuck with chronic, talk about lymphedema. Talk about what this really is, if you don't mind.
So lymphedema occurs when lymph nodes are removed, and the lymphatic system itself is responsible for the removal of waste that your body produces. It also provides immune response in the form of white blood cells, and it recycles proteins back to the heart. Lymphedema actually occurs when too much of that protein starts to build up in the interstitial tissues or the spaces between the cells, and results in the body's need to send fluid down to pick that up and circulate that fluid out of the extremity. And when the body is unable to match the removal of fluid with the amount of fluid that's being produced, it can result in swelling. Long-term swelling can result in tissue changes. The tissues become like a fatty, thickened tissue, and we can make changes to fluid buildup in tissue, but we can't make changes to tissue itself. And that's when it becomes a chronic condition, is when the actual tissue changes. That's what's so good about this technology, is that it is able to find preclinical lymphedema when it's not apparent from the naked eye. It's not apparent from a shirt not fitting right. It's not apparent from jewelry not fitting right. This is truly subclinical. It's not detectable. And if we can find it at that stage 0, subclinical, we can treat it very, very conservatively and keep it from ever becoming that stage 2 chronic condition.
So basically the machine is picking up the amount of water prior to, so if you're someone who has a tendency to swell a lot, would that be an indication that you're going to have a lot of lymphedema?
No, there's no way to detect something like that because you swell, because you may use when you have taken salt or something like that, that's not an indication that there's going to be lymphedema after surgery.
Okay.
This is you're talking about like 2 different systems there. That's more venous system related versus lymphatic system.
Okay, but I'm trying to understand that the machine is picking up before the surgery the circumference. Like, I'm still a little not sure about that.
So the machine sends 256 frequencies, both high and low. The frequencies go through body tissue as well as fluid consistency. And what it does is it gives us a score, and that score is meaningless. It's just a baseline.
I see. That's a baseline.
As we go through, as the patient goes through their journey, we retest, and if that score changes by so many points, then it's the indication that we need to do some type of treatment for that patient.
Okay. So the treatment is really compression, and it's also exercises, right? Anything else?
Correct. It's a combination of things. We call it complete decongestive therapy, and the first aspect of it is fitting a very low class compression class 1 sleeve and some type of handpiece, whether it be a gauntlet or a glove. We fit that first and foremost. We teach the patient a massage technique, and I'll get in trouble from other lymphedema therapists for calling that a massage technique. It's a manual therapy technique called manual lymphatic drainage, which stimulates the lymphatic system to pump at a more efficient, faster rate, and that helps the body catch up with the fluid that's being retained in the area where it's being retained of the limb, usually. And then we also teach what's called decongestive exercises. So that is different stretches and movements that help to create a muscle and joint pump within the system, which brings in the venous system to help pump that fluid out of the tissues. And when you combine all of that together, you have a very good treatment approach that is easily completed at home, and doesn't require you to travel to a therapist or something like that. If that score indicates the need for treatment, we do that type of treatment for 4 weeks, and then we have the patient come back in and retest, and hopefully that score has gone back down into the green range, the safe range, and we can go back to normal living without the need for compression garments and all the other things. And then we're watching that patient. We continue to watch that patient every 3 months. They're coming back to see us. We do a test. The test takes maybe 5 minutes. You got to take your shoes and socks off. You put your hands on the scales. You put your feet on the scales. 30-second test, and they're out of there again. And we can provide them with those reports that come out. And it gives the patient a lot of peace of mind to know that they're being watched and cared for throughout their process.
What percentage of breast cancer patients do you think are prone to get lymphedema?
Well, I think, prone is, if you have lymph nodes removed, there's a risk. And so there's some type of prone there. If you're receiving taxane-based chemotherapies, there's a risk there. If you're receiving radiation, there's a risk there. If you're having mastectomy along with lymph nodes removed, that's a larger risk than having a lumpectomy with lymph nodes removed.
Really?
So everybody's at risk, yes. But about 20% of breast cancer patients develop lymphedema throughout their lives.
20%?
About 20% develop lymphedema, and the highest risk is within, like 75% of cases of lymphedema occur within the first 3 years, which is why we test so frequently in the first 3 years and then reduce that test as they get further and further away from their surgery date.
So if somebody doesn't get this test and they develop lymphedema and they don't have the proper care, like someone like you, what happens to them? What's it feel like, and what do they do?
So the signs and symptoms of lymphedema is the acronym HAVENT with a V instead of an F. Heaviness, achiness, fatigue, numbness, and tingling. Those are the typical precursors to a chronic lymphedema. It's usually not painful. Most patients don't feel a lot of discomfort from the developing stages of lymphedema. In the early stages, you're going to start, what you'll notice first is possibly your rings not fitting, your bracelet not fitting, your shirt sleeve not fitting. And that can progress as you go through. The problem a lot of times is that patients don't know who to go to or who to talk to, which in my personal opinion, you should go directly to your physician as soon as you start to feel those early symptoms, and let them know. And hopefully they can provide you with a referral to a lymphedema specialist.
Would you say that most breast cancer patients come in educated about lymphedema?
All of our breast surgeons, and I can't speak for everybody, but I only take referrals from inside of our facility, and that's just because we don't have the manpower to take outside referrals, and we have 17 different locations throughout the state.
Wow.
But our breast surgeons do an excellent job of providing education. And for those patients that they know are going to have a larger number of lymph nodes removed or are at that higher risk because of the treatment they're going to require, our breast surgeons are very good about getting those patients in to see us before their surgery, and we provide the education that they need at that time.
Do you guys have questions for James? I think it's so important that the breast cancer community is aware of this. I know there's Lymphedema Awareness Month, but there's so many people getting faced with a breast cancer diagnosis all year long, every single month. And this topic is just like I mean, James, do you agree? I mean, I just feel like it's under, you probably don't feel like because you live it every day, but I get the sense, right?
I do think that, like I said, I think it's an area that is undereducated and underpracticed, and the patients are underserved, and it has always been like that. I've been doing this for 12 years now, and it has always been an area that's underserved. And it's not just breast cancer. I mean, any malignant melanoma, any pelvic cancers, they're all at risk because lymph nodes are typically taken with those types of cancers, and sometimes those cancers do invade the lymphatic system themselves, and that can lead to lymphedema. So, and that's a whole nother ballgame. So
yeah. Now I only had my sentinel node, just one, but they didn't seem to care about lymphedema until afterwards. And so that's why I'm always fascinated with so much of all of this, because, you know, I think having that discussion up front, maybe we emotionally can't handle it all if it has been discussed, but I know that it wasn't for me. I don't know anyone else on here, and then if you guys felt that this was addressed, you know, if you were having surgery. But I mean, I feel fortunate that I did not have that. Now I have radiation stiffness. I can't move this arm past this. Look at that. Now is that part of lymphedema? That's ridiculous, guys. You see that? Cannot move it. Can't. Right.
You would definitely benefit from some oncology rehab to stretch those tissues out.
Yeah, I think so. I mean, this is scar tissue buildup. This is like a mess here. This is 5 years later. So again,
it's never too late. It's never too late.
Yeah, but I think the skin gets so damaged, and so let's talk about never too late with lymphedema. If somebody is 2-3 years out and still suffering, is this curable?
It is not curable. Lymphedema is a chronic condition. It's not curable, but it is very manageable. Through complete decongestive therapy, we can provide the education and the treatment approach to help that patient become independent and live a very full and productive life.
Yeah, well, that's wonderful.
You know, in the cases where there is chronic conditions such as lymphedema, there is a chronic lymphedema occurring, we can provide complete decongestive therapy and include wrapping the arm to reduce the swelling, and then fitting with a higher class compression garment to help them become independent and functional.
Someone's commenting saying they're not sure when to wear their sleeve. Do you see that, James?
I do. So there's a lot of questions I would have is, was there swelling at one point? If that's the case, then wear the sleeve during waking hours. You don't wear it to sleep in. If there isn't swelling, or there wasn't ever swelling, then you should wear your sleeve during high activity times, such as heavy activities. It looks like you're going to Tahoe. So like, let's say you're going to go snow skiing, and that's an activity you don't usually participate in. I would definitely wear your compression sleeve when you do those kinds of things. Heavy household tasks, like vacuuming or shampooing your carpets or something like that, I would wear your sleeve. Exercise, I would wear your compression sleeve. There's a little bit of there's some questions that are coming out, being raised about whether or not to wear them when flying. To me, it's you're changing. The way that they have always said this is, the higher the altitude you get typically means that the further you're traveling, and so the cabin pressure is different with those types of flights. And so I just look at it, always side with caution. Wear your compression sleeve when you're flying. If you've got one, wear it. It's definitely not going to hurt anything at all. And if you've
compression sleeve,
and I see that you,
I'm going to write that down.
I saw that you did some, your therapist had done some light massage with you. Have your therapist teach you how to do some light massage for yourself, and do those things before you participate in those activities. Then put your compression sleeve on before you do those activities, and you're very well protected in that situation. And watch for those signs and symptoms: heaviness, achiness, fatigue, numbness, and tingling. Can't stress that enough. If you feel those things, say something.
What'd you say? Heaviness, tingling?
Heaviness, achiness, fatigue, numbness, and tingling. And that's in the extremity that you have, of the side that you had the lymph nodes removed.
Side where lymph nodes were removed. And that is after surgery?
Yes, after surgery.
And how quickly should someone raise their hand? Like, if you just had a double mastectomy and you're feeling heaviness, numbness, tingling, and fatigue, a week later, is that like, hey, I got lymphedema?
No, but it's definitely something that I would talk to your doctor about and say, I am feeling these sensations. I would like to speak to somebody who knows something about this, because it definitely could be the early stages, and it's never too early. It's never too early.
And then they would get on it on how to manage it with exercising and compression and all of that. But there's no medication, is that correct?
There's no medications. There's no special diet for lymphedema. It's really it's more about knowing how to prevent it, knowing how to, and there's a very good resource on the National Lymphedema Network, and it's one of their what do they call them? It's one of their the things that they put out. It's called Healthy Habits for Patients at Risk for Lymphedema. And it gives you a lot of very easy things that you can do to reduce your risk.
I still struggle with like when you say how to prevent it. Like if your body's going to react from the fluid, isn't it just going to happen? You can't really stop it, though, can you?
You can't stop it, but again, you can reduce your risk. And those things include staying active, eating well, maintaining a healthy weight, increased weight gain after breast cancer is one way to increase your risk of developing lymphedema. Take care of your skin, moisturize your skin, keep your skin. I know that this sounds like an oxymoron, but moisturize your skin at the same time. Keep your skin dry in those areas that the lymph nodes were removed. Protect your skin from sun. Wear sunscreen. Use care with razors when you're shaving under your arm. And a lot of times, as you know, you don't have as good a sensation as you did before your surgery, and so be very careful with razors and things like that.
That's so interesting.
Have regular medical checkups with your physician, and try to see if you can be referred to a certified lymphedema therapist. Know the signs and symptoms of infection. Your lymphatic system plays a huge role in your immune function, and so having lymph nodes removed does not make you immunocompromised. I'm not going to say that, but it does increase the risk of developing infection. So in that way, know the signs and symptoms of infection. If a scratch or puncture occurs to your skin, then treat it a little bit more diligently than you did before your surgery. So clean it with an antibacterial soap, apply Neosporin, apply a Band-Aid, and then watch for the signs and symptoms of infection. And you may even keep a little small first aid kit when you're traveling.
Okay.
Injury and trauma is a big thing. So wear gloves when you're messing around with, when you're washing dishes, gardening, or using chemicals like detergent. Those kinds of things really dry your skin out, and that leads you to a higher risk of developing nicks and scratches and openings that can lead to infection. And then avoid punctures, injections, and blood draws on the side that you had the lymph nodes removed.
Boy, that's really good.
Do it on the other side. Also avoid lymph constriction, so don't carry your heavy purse on the side that you had lymph nodes removed. Carry it on the other side, because that heavy purse cuts off your circulation and movement of fluid out of that extremity. And try to avoid blood pressure cuffs on that side. Do it on the other side.
You need
And then
to do a video for me, James. I'm writing all this down. This is great stuff. Everyone needs to hear this.
Well, like I said, this is a healthy habits for patients at risk for lymphedema. This is a whole handout that's on the National Lymphedema Network. You can look at their position papers, and it talks about exercise. It talks about plane flight. It talks about these risk factors and healthy habits that you can do. And it's very easily seen on their website.
Wow, this has been incredible, James. I am actually going to give this to my editor so we can put these in bite-sized 1-minute pieces of information. It's very, very, as you would say, valuable, invaluable, I mean, priceless. It's wonderful that you have taken the time to share with all of us this information. And those of you that are on here, guys, if you can share this with anyone you know that is about to go through surgery, I mean, this is like a golden ticket, you know, to understand this. So we need to get this information out there. We here together with the doctors at Learn Look Locate are doing everything we can, but we need to lean on everyone else to help us, you know, kind of whisper down the lane and say, hey, you know, make sure you know about this. There's a lot to digest. So, guys, do you have any questions for James?
There are a couple of questions here.
Yeah.
She asked, what is a safe moisturizer? You want to use a moisturizer that's hypoallergenic. You want to use a moisturizer with a pH level of about 5 to 5.5. Very common ones that are over the counter, Eucerin, Cetaphil, CeraVe, all of those are really, really good lotions. She asked about the side of the mastectomy or any part of the body. You're at risk for lymphedema on the side that you had lymph nodes removed. So if I had a mastectomy and I had lymph nodes taken out of my left side, your lymphatic system is broken up into quadrants. So whatever affects my left side is not going to affect my right side. So really you only need to watch for the signs and symptoms of infection, practice your skincare, don't take vaccines or blood draws, and don't do blood pressure cuffs on the side that you had the lymph nodes removed. Everywhere else on your body is fine.
Wow. This is great. Absolutely fantastic. We had a small crowd tonight, but I have a feeling people will come back to this. It's going to sit on my Reels grid so that people can, you know, come and see it at their leisure, James. So any last closing thoughts, guys?
Really, somebody else asked.
Yeah.
Vestal asked too, where can she buy sleeves on Amazon? Yeah. I would be careful with buying something that you haven't been fit for, because there's different things that you look for. You look for size, but you also look for compression class. And let a trained professional help you make that decision. And a lot of times that professional will also be able to purchase those garments for you. And next year, hopefully in January, the Lymphedema Treatment Act just passed Congress this past December. They are currently, I think they're finished, but they have been negotiating with CMS about what will and won't be paid for. But as long as I've been working in lymphedema, compression garments and anything related to lymphedema has never been covered. It's always been an out-of-pocket cost to the patient.
Yeah, that's so
we're going to have coverage starting next year. So it is incredibly exciting that we're going to start being able to get our patients what they need.
That's wonderful.
At no cost. So I'm really excited about the future.
That's great. That's a really great way to end our live. I mean, so people know, because it's so hard. There's so many of the unique tests and things that are out there to help us that, you know, aren't covered. So to hear this is a step in the right direction, right?
That's right.
So, well, we are so grateful for you, James. It's really awesome to connect. And I want to do this again, because I think once October calms down a little bit, we'll be able to cut through some of the clutter and get you out here, because we have to do this more often and not just during this 1 month. So whenever you're available, and sometimes it's fun to just pop on here and have a chat, and people will pop on. So the pre-promotion has been hard because everyone's kind of busy and there's a lot of noise right now. But if you guys want us to do this again, James is always really great about popping on and sharing. I think his passion aligns with mine, right, James?
I would agree.
Yeah. So please give your wife my best. And guys, any last closing thoughts? I'm trying to see if there's any other comments. Is lymphedema reversible? Wow. James?
No, unfortunately, it's not reversible, but it is easily managed with the idea is there's different stages of lymphedema, and this could be a whole conversation in and of itself, but the idea is to move back a stage and to get that patient to a point where it's not necessarily reversible, but very manageable, and teach you how to do that yourself.
Wow. Well, guys, any last thoughts? James?
I'd love to come back and do some more.
Yeah, let's do it again. I think it's great. Thank you guys for popping on a Thursday. And it was late. I'm on the Pacific time, so it's not that late for me, but really appreciate the conversation and the engagement. Thanks, guys, for asking the questions. We are going to continue to raise the much needed awareness. Hi, Carrie. Thank you for being on and being supportive of lymphedema. And yeah, that's just another piece of the puzzle, and it's a big one. I don't want anyone to suffer with this chronic, irreversible condition. So you are critical to my mission, James. So I'm going to be bugging you more.
Please do.
All right, guys. I will share this. Thank you, everyone.